The rabies virus is one of the scarier viruses that we know of today. It is an extremely deadly virus that is present in animal saliva and contracted by humans after a bite from a rabid animal. Remember, the rabies virus is a negative-stranded RNA virus that is bullet-shaped. After a bite leading to local inoculation, the virus binds to nicotinic acetylcholine receptors and travels via retrograde transport from the peripheral nervous system back to the central nervous system. In the central nervous system, the virus can infect Purkinje cells of the cerebellum as well as hippocampal neurons. When the virus infects these particular cells, the virus forms what are called Negri bodies, as we see in this image here. Negri bodies are cytoplasmic inclusions found in the cells infected by the virus. After initial infection, the incubation period may be weeks to months before symptom onset occurs. Clinically, patients infected with the virus initially have flu-like symptoms, including fever, malaise, anorexia, and fatigue, that eventually progress to more serious symptoms such as seizures, hydrophobia or a fear of water, hypersalivation, as well as photophobia. Even more scary, the symptoms can progress and cause a fatal infection, which is paralysis that may lead to respiratory failure, coma, and even death. If someone is suspected of having been bitten by a rabid animal, post-exposure prophylaxis should be administered in the form of the killed rabies vaccine, or the human rabies immunoglobulin should be administered. Rabies is one of the few infections where post-exposure vaccination can be used to prevent the person from actually manifesting the fatal encephalitis. Unfortunately, if the patient has established rabies, these precautions do not have much effect.